Thank you for your interest in our efforts to create ecosystems for healthy lifestyle. My name is Michael O'Donnell, and in this short presentation, I'll be talking about the problem that our toxic lifestyle habits are killing us and making us go broke. For example, if we look at the leading cause of death in the United States, we discover that lifestyle is actually the primary cause for 8 out of 10 of those. The exceptions being Alzheimer's and influenza and pneumonia, for which lifestyle is actually still a strong cause. The big culprits are tobacco and inactivity and poor diet. And we know, for example, that among smokers, the death rate at every age is double that of non-smokers. We also know that smokers die prematurely, 10 years on average compared to smokers. We know that smoking damages virtually every organ in the body, and it kills an estimated 480,000 people prematurely every single year in the United States. We also know that as physical activity increases, the risk of disease actually decreases for osteoporosis, for obesity, diabetes, stroke, heart disease, functional health status, many other diseases. The exception really being musculoskeletal injuries. As people exercise too much, they actually do have higher rates of injury. We also know that as people's quality of their diet gets worse, their likelihood of dying increases for all deaths, for cancer, for heart disease, for stroke, and other diseases. We estimate that overall, poor diet and inactivity accounts for about 300,000 premature deaths every year. And that actually leads us to costs. When we look at annual medical spending, as we would expect, as people get older, their medical spending increases. What is actually a fascinating discovery is that as the number of risk factors increases, so do medical costs. And by risk factors, we're talking about, for example, being inactive, using tobacco, having a poor diet, being overweight, not wearing a seatbelt. And we've discovered that for someone, for example, about age 40, as the risk factors increase, they're spending about the same for somebody who's 40 years old with 5 or more risk factors. They're spending about the same as someone who's 75 years old who has 2 or fewer risk factors. The bottom line is that lifestyle leads to chronic disease, which drives most medical spending. It works out to about 75% of all spending, but for Medicaid and Medicare, it's actually a lot higher. It's actually the vast majority of those costs. We now know that health plan coverage for a family costs almost $20,000. And this is a major burden for employers who provide coverage for their employees, and even for employees who have coverage. But it's really crushing to people who don't have employer coverage. We find that they're actually spending about a third of their total household income just to provide the coverage. Now, medical spending is also a major problem for state governments. In Colorado, healthcare spending is the #1 line item. It's more than education or everything else. 29% of the total budget, about $8.2 billion. And this is typical for states around the United States. But amazingly, the costs we've been talking about are not the biggest problem, because these are the costs for people under age 65. And those costs are significantly lower for people who are 65 and older. And those are the costs that are covered by the federal government through Medicare. And the Congressional Budget Office has been studying this for a long time. I actually first discovered this problem when I read the long-term budget outlook for the Congressional Budget Office in 2011. And this looks 75 years in the future. And basically what we find from this projection is that medical spending will consume 100% of all federal tax revenues by the end of this century. and it's driven by an aging society and chronic disease caused by lifestyle. Now, this is the problem that I've been studying with 10 of my volunteer colleagues. Collectively, we have several centuries of experience in harnessing lifestyle as medicine in clinical, corporate, community, policy, and entrepreneurial and academic settings. And we are also the parents and grandparents and aunts and uncles and neighbors of all the children in Colorado. And our goal is to give them the best opportunity to achieve their dreams through healthy lifestyle and good health. So I would encourage you to take a look at our website, ecosystemsforhealthylifestyles.com. It has this short presentation on the problem and also short presentations on our proposed solution and our approach. And then it has in-depth presentations on a number of topics, a white paper, and then also opportunities for you to get involved to help us solve this problem. I look forward to working with you.